All around us every morning, people are heading to work, dropping kids off at school, and moving through the frenzied pace representing life in our city. To maintain this pace, it's important that people be well and stay well. And the pattern for wellness later in life is often shaped by what happens to us early in life. The Escuelita schools of Dallas, with a rich history of preparing pre-kindergarten students for school through English immersion, is a true center of excellence in this community. Escuelita Schools is pleased to partner with My Children's Primary Care Centers in introducing telemedicine to this community. Although telemedicine uses innovative 21st century technology to bring high-quality care right to the school, at the center of this is a distinct human touch, the kind of touch that helps children get well, stay well, and establish a pattern for a healthy future.
Children's has been a strong supporter of Escuelita for years and years. And when we were approached about the telemedicine clinic, I cannot tell you how excited our staff were, because there is such a need in our community for this service.
My job involves working in a call center, and it is demanding. It is almost impossible for me to leave the center because my job requires me to respond to calls. The reason my children attend Mi Escuelita is to help them with learning English. Language is very important, and learning English will help them with their transition into kinder. The Telemedicine service provided by My Children's gives me another reason, because it makes it much easier for my son to be seen by a nurse and a doctor simultaneously via a computer. The relationship that has been initiated between My Children's and Mi Escuelita, in my opinion, is beneficial for the families and the community.
Our mission through telemedicine would be to provide the excellent care that we normally do through My Children's, but we want to increase access to physicians so that kids who normally would have to go to the ER for minor illnesses can be taken care of in their own environment in school or daycare programs.
Having the teleclinic in the school is good because the parents do not have to miss work, and it allows them to make better use of their time. The parent will benefit, as I first stated, work-wise, and it will alleviate the need to commute, and it is economical.
I think telemedicine creates more efficient and a convenient way to reach kids. You get the same quality of care over the video technology that you would as if you were walking into a clinic.
They have a monitor and all of the equipment needed, such as a stethoscope and an otoscope. Aside from the medical equipment, My Children's will designate one of their nurses to perform all medical exams. A doctor will simultaneously observe all medical exams through live video. The high-definition cameras used are so sensitive even the skin pores can be seen in detail. Throughout the exam, the nurse will follow the doctor's instructions. For example, he or she may want to see the child's mouth or nostrils. The doctor will determine the child's ailment and will continue to communicate with the nurse regarding next steps, including the need for medical prescription. Once the doctor determines the diagnoses, the doctor also prescribes the medication and sends the prescription request to any pharmacy. This makes it easy for me as a parent. All I have to do is show up for my son, who has already been examined by a doctor, and pick up the medicine at the pharmacy. I don't have to go to an emergency room and wait for 6 or 7 hours after having worked so many hours.
I'm a firm believer that strong schools create strong communities. And in those strong communities, you have to have a strong system for health care. You have to have it available to the families, accessible. They have to feel comfortable going there.
This is an important cultural change for the kids. As I stated earlier, unfortunately, the Hispanic culture does not practice going to the doctor until someone is seriously ill. I believe this partnership between Mi Escuelita and my children's will form a new culture amongst the children, which is something we want. We want the children to know there are medical services available and accessible to them. So this is where we are able to form a new culture, a culture of prevention.